Your bones are alive and ever-changing. Your skeleton forms the framework for your body. It enables you to move and helps protect internal organs. Postmenopausal osteoporosis is a disease in which bones become fragile and more likely to break. In women, bone loss increases after menopause when estrogen levels drop. In the 5 to 7 years after menopause, women can lose up to 20% of their bone mass, leaving them at risk for fracture. Everyone has cells that remove bone in their body and other cells that rebuild bone. This ongoing process is part of what keeps your bones strong. But when you have postmenopausal osteoporosis, the bone-removing cells cause you to lose bone at a rate that is too fast. Your bones become weaker, more likely to fracture. If you have postmenopausal osteoporosis and have a high risk for fracture, one possible treatment option that is proven to help strengthen your bones is Prolia denosumab.
Prolia is a prescription medicine used to treat osteoporosis in women after menopause who are at a high risk for fracture or cannot use other osteoporosis medicine or other osteoporosis medicines did not work well.
Do not take Prolia if you have low blood calcium or are pregnant or plan to become pregnant, as Prolia may harm your unborn baby, or are allergic to denosumab or any ingredients in Prolia. Prolia is the result of recent thinking in bone science. This has changed how we think about bone loss and ways to treat osteoporosis. It helps stop the development of bone-removing cells before they can reach and damage the bone. Prolia works by targeting a molecule that the bone-removing cells need in order to work. Prolia helps stop the development of bone-removing cells before they can reach and damage the bone.
Prolia is the first and only treatment for postmenopausal women with osteoporosis at high risk for fracture that is given as a shot just under the skin once every 6 months in your doctor's office. You should take calcium and vitamin D as your doctor tells you while you receive Prolia. After your treatment with Prolia is stopped, your risk for breaking bones, including bones in your spine, is increased. Do not stop taking Prolia without first talking with your doctor.
Prolia is proven to help strengthen bones and help increase bone density, and it is proven to significantly reduce your risk of fracturing your spine, your hip, and other bones.
Prolia can cause serious side effects. Possible serious side effects include serious allergic reactions, low blood calcium, severe jaw bone problems, unusual thigh bone fractures, increased risk of broken bones, including broken bones in the spine after stopping Prolia, serious infections, skin problems, and severe bone, joint, or muscle pain. Ask your doctor if Prolia is right for you. Here's some important safety information you should know about Prolia. Do not take Prolia if you have low blood calcium or are pregnant or plan to become pregnant, as Prolia may harm your unborn baby, or are allergic to denosumab or any ingredients in Prolia. What is the most important information I should know about Prolia? If you receive Prolia, you should not receive Exgeva. Prolia contains the same medicine as Exgeva, denosumab. Prolia can cause serious side effects. Serious allergic reactions have happened in people who take Prolia. Call your doctor or go to your nearest emergency room right away if you have any symptoms of a serious allergic reaction, including low blood pressure, hypotension, trouble breathing, throat tightness, swelling of your face, lips, or tongue, rash, itching, or hives. Low blood calcium, hypocalcemia. Prolia may lower the calcium levels in your blood. If you have low blood calcium, it may get worse during treatment. Your low blood calcium must be treated before you receive Prolia. Take calcium and vitamin D as your doctor tells you to help prevent low blood calcium. Severe jaw bone problems, osteonecrosis, may occur. Your doctor should examine your mouth before you start Prolia and may tell you to see your dentist. It is important for you to practice good mouth care during treatment with Prolia. Unusual thigh bone fractures. Some people have developed unusual fractures in their thigh bone. Symptoms of a fracture include new or unusual pain in your hip, groin, or thigh. Increased risk of broken bones, including broken bones in the spine after stopping Prolia. After your treatment with Prolia is stopped, your risk for breaking bones, including bones in your spine, is increased. Your risk for having more than one broken bone in your spine is increased if you've already had a broken bone in your spine. Do not stop taking Prolia without first talking with your doctor. If your Prolia treatment is stopped, talk to your doctor about other medicine that you can take. Serious infections in your skin, lower stomach area, abdomen, bladder, or ear may happen. Inflammation of the inner lining of the heart, endocarditis, due to an infection may also happen more often in people who take Prolia. You may need to go to the hospital for treatment. Prolia is a medicine that may affect the ability of your body to fight infections. People who have weakened immune systems or take medicines that affect the immune system may have an increased risk for developing serious infections. Skin problems such as inflammation of your skin, dermatitis, rash, and eczema have been reported. Bone, joint, or muscle pain. Some people who take Prolia develop severe bone, joint, or muscle pain. Before taking Prolia, tell your doctor about all of your medical conditions, including if you take the medicine Xgeva, denosumab, have low blood calcium, cannot take daily calcium and vitamin D, had parathyroid or thyroid surgery, glands located in your neck, have been told you have trouble absorbing minerals in your stomach or intestines, malabsorption syndrome, have kidney problems or on kidney dialysis, plan to have dental surgery or teeth removed, are pregnant or plan to become pregnant. Females who are able to become pregnant, your healthcare provider should do a pregnancy test before you start treatment with Prolia. You should use an effective method of birth control, contraception, during treatment with Prolia and for at least 5 months after your last dose of Prolia. Tell your doctor right away if you become pregnant while taking Prolia. Are breastfeeding or plan to breastfeed. What are the possible side effects of Prolia? It is not known if the use of Prolia over a long period of time may cause slow healing of broken bones. The most common side effects of Prolia are back pain, pain in your arms and legs, high cholesterol, muscle pain, and bladder infection. These are not all the possible side effects of Prolia. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Talk to your doctor to learn more about Prolia.